Hello. Today I will be presenting tuberculosis, and I started with a few abbreviations that I will use in the next slides. So TB is the common name for tuberculosis. PTB is pulmonary tuberculosis, which means that it presents in the lungs, and that accounts for about 85% of all cases worldwide. EPTB is extrapulmonary tuberculosis, when TB presents anywhere in the body outside of the lungs, and that accounts for the other 15% of cases worldwide. On a microscopic scale, the causative agent for TB is Mycobacterium tuberculosis. This was discovered by Robert Koch in 1882, and it was a huge discovery because TB has been prevalent since Greek and Roman times, and it has a very high mortality rate for people that are untreated. So once they were able to discover the causative agent, they found cures and vaccines against it. There are a few very unique characteristics of TB. One is that the generation time for the bacteria is 15 to 20 hours, which is extremely slow for bacteria. Normally it's between 15 minutes to 1 hour. Another interesting characteristic is that it is an obligate aerobe, so it requires oxygen, which is why it is primarily found in the upper respiratory tract, primarily in the alveoli. It can be found in the bloodstream and in the lymph, which is how it travels to the rest of the body, but it does prefer the lungs. It is also a facultative intracellular parasite for macrophages. So once it enters the body, it can live on its own, but if macrophages come and engulf it, they are able to live and thrive inside of macrophages. The reason for this is its very unique cell wall. So the cell wall is composed of 60% lipid, and 50% of that is mycolic acid. Now, mycolic acid is only found in the genus Mycobacterium, and what it does is it creates an extremely hard shell that almost nothing can penetrate. So even in a macrophage that is attacking with lysozyme or other chemicals, it cannot be penetrated, and that is the reason that it can act as an intracellular parasite, and also the reason why it is resistant to most antibiotics. And it's also the reason why it is acid fast. So in a Ziehl-Neelsen stain, it will be red. Transmission is human to human. So when someone coughs or sneezes or talks, they release airborne particles called droplet nuclei. And in each nuclei, there's 3 to 10 bacilli of the bacteria. And these, because of their small size, they're able to stay airborne for several hours. This can be decreased by a well-ventilated area or by sunlight, but they can stay for as long as like 3 to 5 hours in the air. And when someone releases these airborne particles and someone else inhales them, most get trapped in their mucous membrane, but others arrive in the alveoli and start to generate. Now, if you have latent TB, that means that you are not contagious. So you do not release anything when you spit or when you release airborne particles. But if you have active TB, then you are contagious. And the way to tell if you have active TB is by doing a sputum sample. And if you are smear positive, that means that the bacteria from your sample are acid fast. And this accounts for 75 to 80% of all active cases. They are usually smear positive. And there's a much lesser percentage of smear negative, which means that in your sample, the bacteria are not acid fast. So there are 5 stages of TB. Stage 1 is when you first inhale the infected nuclei, and most of them again become attached in the mucous membrane and are eliminated. But if they reach the alveoli, then stage 2 begins, where 1 to 3 weeks after your first infection, TB cells are just undergoing rapid growth and unrestricted growth. They're being taken up by macrophages, and since the macrophage is inactive, it cannot do anything to the TB cells, and so they just generate from within the macrophage, and eventually the macrophage bursts, killing the macrophage. More macrophages appear, the TB cells again become engulfed and live inside the macrophages. Stage 3 is when T cells are activated, and they release cytokines which activate macrophages, and this is when granulomas form. So a key component of tuberculosis is these granulomas, which are basically the bacilli are taken up by macrophages and they form a cluster that are then surrounded by lymphocytes, and essentially the TB cells they can't keep generating unrestricted. So they are kept under control, and for latent TB, this is where it ends. You can have these granulomas for your whole life. So you could have dormant TB cells after infection for your whole life, but you are no longer contagious because they are encapsulated in these granulomas. And you can see in the image A and B for oral TB, those would be granulomas, and especially in chest x-rays, that is how you primarily identify if someone had TB, is because you can see those white circles. Those are granulomas in the lungs. Stage 4, the granuloma continues to grow. So if you have a weakened immune system, then the bacteria continue to grow, and they eventually kind of like break the granuloma. So it liquefies, the center liquefies, and the bacteria are able to spread throughout all the lungs. They invade the bronchus or they invade the bloodstream. And stage 5, the centers of granulomas liquefy, which causes unrestricted growth, and even they begin to have unrestricted growth extracellularly, which causes the bronchi to become necrotic and rupture. And this is how destruction of the lungs is a symptom of TB. And I found a helpful diagram to kind of understand better what's happening with the granulomas. So in the first picture, you can see that the bacteria live within the macrophage. When T lymphocytes are then activated, they surround the macrophages that are now infected, and they start to form a granuloma. And so you can see there, then B lymphocytes come and they just form a protective layer around the infected macrophages and around the bacteria. And this is the end for latent TB infection. This is what happens. But if you have an active TB case, then the bacteria continue to grow within until finally it ruptures. And then the bacteria are able to access the rest of the lungs and the rest of the body through the bloodstream. So tuberculosis does have a cure as well as a vaccine, and it is 100% curable if given the right drugs for the right amount of time. If you have a case of latent TB, that means that your immune system has formed these granulomas and has essentially taken care of the problem for the rest of your life. They will not be able to escape the granulomas, and they will remain dormant, if not dead, forever. If you have a weakened immune system, then you might be at risk of developing active TB, and your doctor might prescribe you isoniazid, which is the primary drug to treat TB. If you do contract an active case of TB, then 4 drugs are prescribed every single day for 6 to 12 months, and they must be taken for that amount of time unless you develop drug-resistant TB, multi-drug-resistant TB, or the latest, which is excessively drug-resistant TB. And this is occurring because TB usually happens in very poor countries or countries with poor healthcare systems. And patients who are unable to afford the drugs after a month or two, they no longer have the money for it, the cells develop an immunity to the drugs that they had been taking, and then they pass on the tuberculosis. And so we find these three strains. The XDR TB is extremely concerning, like today, because it is resistant to every single drug that has commonly been found to prevent or cure TB. So XDR TB is not curable, and it is gaining prevalence in India and China especially. The vaccine, there's one vaccine for TB, which is the BCG vaccine, and it was found in 1921. So you would think that TB might be able to be eradicated, but it is actually the second leading cause of death by an infectious disease right after COVID as of last year. So in 2020, 10 million people were diagnosed with tuberculosis and 1.5 million people died. It is the 13th leading cause of death in the world, despite the fact that we have an effective vaccine that was found 100 years ago, and it is 100% curable with the proper drugs. This is primarily, the outbreaks are primarily in India and China. This is due to overpopulation. Just close contact makes TB more transmissible, as well as not being wealthy enough to afford the drugs, and poor healthcare systems that are not offering the vaccine. Ideally, as soon as any child is born in a country where TB is a problem, they would be given the vaccine within a week of them being born. And the World Health Organization does have a plan to eradicate TB by 2025. They have tried this in the past. They've been working on minimizing tuberculosis, but it is still extremely prevalent due to not being able to afford the medication. And if you take it for a month or two and then stop, all these new strains are becoming a huge problem, because now the newest strain is incurable. So yeah, that is all I have to say about tuberculosis. These are my references, and yeah, thank you.